So here we have a simulation that looks slightly different to the one before. There's still process steps that patients go through. So this is a GI department. And the idea of this department was that they wanted to test patients and get them to treatment within a day. And that is quite ambitious because typically if you're coming for an endoscopy, we've got two types of endoscopy here. You would likely come, have your test, go away for 2 weeks, wait until your primary care physician reports back, come back in, have more tests. What we're trying to say here is to reduce that big waiting list, that big backlog. Let's try and build a system where we can see people and treat them within a day. Now, if we made decisions to these endoscopy units in isolation, it would be a lot easier. We could just say, well, how many units do I need? And I can see the way I've got this set up. I've only got 4 of the 8 switched on for transnasal as well as oral endoscopies, and it's coping pretty well. My whole system, the queues are never that big. The problem I've got is if I make changes to this, so I'm thinking about reducing my waiting list even further, getting through more patients, getting more revenue. Actually, some of these patients require a shared service. So these CT scanners are in use throughout the whole hospital. So if we have more endoscopies, there's going to be a small percentage of those patients that require a CT scan. And if we push more in the front door, more people will need a CT scan. So if we want to make this system better, we need to understand how it's going to impact these shared services that are maybe downstream. So I've taken results for the CT scanner because this is what I'm interested in seeing. Right now, the average queuing time is really short. So if I want to see people in a day, that's going to be fine. 100% of them are seen within 60 minutes. You can see that the queue does occasionally grow, but it's always manageable. And a lot of patients actually from this top queue, you can see, don't have any wait at all. So let's ask what if. Let's change the simulation settings and see what impact that has. So what I'm going to do is come to my capacity, and I'm going to increase the amount of endoscopy suites I have from 4 to 6. I'm going to keep all my staff, etc., the same. So what's going to happen now is because we've got 6 rooms open here, we're going to each slot bring in 12 patients rather than the 8 we were bringing in before. So that's it. We're going to utilize the new capacity that we've got. So I'm going to run this simulation again. And the first thing is to check. Yeah, so we're now using 6, and we can visually see that we're using 6 compared to 4. And what we should start to see with this simulation before the results even populate is, are we going to have a problem with queuing, particularly at this CT scanner? It doesn't seem too bad at the moment, but occasionally, actually, it looks like this queue is getting quite long. Similarly, for the discharge consultation, more people are coming in, so more people need to get out. So we want to see, is this area going to cope? I'll run it quite quickly now so we can actually see the results. I mean, visually, when you run this, you will see this queue going quite long, especially if you did a trial. So I'm going to run this quite quickly. And what we can see actually is that our queue on some days doesn't even ever fall back to 0. So that means that patients are, in effect, when we're closing this service down, still waiting. Now, we get through that with overtime. We could make a case for, we might have to stay on for an hour or so on some days. But ultimately, it looks like we're no longer coping here. So the average queuing time is 66 minutes. The percent seen within our target is only 44%. So it's simply not going to work. And now the question becomes, if we're designing this new service, should we have a new CT facility? And that is probably going to work, but it might come at a cost, and we don't want to kind of crack a nut with a sledgehammer if we don't need to. And what we were able to do in this simulation through a lot of what if testing was actually find a way to not increase the CT scanners, but still manage our new demand. And what we could see from this chart was that actually it was kind of mid-afternoon where the chart was hitting its peak. But in the mornings each day, the queue was relatively small and patients were performing quite well. So what we did was kind of have a plan to rebalance when patients use the CT scan. So what we said, we had a rule that said, if you come out of one of these endoscopy suites and you do need a CT scan, but I can see that the queue is quite long, just send the patient home, but book them in early the next day for their CT scan. And what that means is they get booked in at the times when the CT scanners are likely to be idle anyway. So there's no huge financial investment. Patients are still getting the results they need. It might be that, okay, we can't get my results in a day like the original plan was, but it's going to be a day and a couple of hours. So that was seen as a better patient experience.